This is just the beginning. That's the world that...
The second group, which is the investors for social change in Africa. And thirdly, the influential leaders or players such as corporates and government leaders. And the reason why we're looking at systems change, it is particularly important given that as a collective of social entrepreneurs and change makers, we are hearing and witnessing the following. One, the need to demystify and contextualize systems change in Africa. The need for social entrepreneurs to continue to figure out and find ways to address barriers or to move barriers that they're experiencing, especially to funding. And this is because the work that they're doing, the impactful work that they're doing needs, support, funding being at the top of the priority. And also there is still a strong investment bias towards expert-led social ventures or social entrepreneurs, right? So we have those who are experts. It seems like from research and just anecdotal conversation, something that is pretty much public knowledge, there is a bias, in terms of funding towards them. While at the same time, there's remarkable solutions on the continent, and there is enthusiasm around social entrepreneurship and social enterprises and the power of market. Now, to get us into this conversation and details and the tactics and the strategies that they are applying, I want to introduce our panelists. We're going to really help us have a feel of what this is all about, everything that I've said. We have Shona McDonald, who is the founder and executive director of Shona Equip. She's a social enterprise based in South Africa. We have Covin Naido. Covin is a global head, advocacy and partnerships for One Side Foundation, also an Ashoka Fellow in South Africa. We had Olusen, who is a global director, budget IT foundation, Nigeria. And we have Stephanie Schmidt, who is the head of partnership for Ashoka Africa. So the way we are going to run this is I have a couple of questions to the panelists who will, kind of just indulge us, and then we will have towards the end questions coming from you and maybe your comments and your feedback. We'll have about 10 minutes for that. And so let's get the ball rolling. And I want to go in this order for the speakers just to know. I'll start with you, Covin, sorry. Then Shona, then Olusen, and then Stephanie. I have maybe 2-3 questions for you. So Covin, just starting with you, maybe just introduce, and for the other two fellows, Shona and Olusen, you'll do the same. Introduce briefly the issue you are addressing, the solution you are developing, and the extent to which your impact has reached to date. Start with you, Kevin, then Shona, and Olusen in that order. Thank you.
I'm muted, sorry. Thank you very much, and thanks for the invite to speak here. It's a pleasure to share some ideas and also learn from the rest of you. I'm an optometrist by training, so much of my adult life has been focused on creating access to eye care, but particularly creating access to what we call refractive services and eye exams and glasses, which in my very first meeting with the World Health Organization, together with Professor Brian Olden, awesome. we were told it's not an important issue for them. And there was no classification of the problem until we produced the research to show that only 20% of the people in the world who needed a pair of glasses was able to access it. There are currently 2.7 billion people in the world who need a correction and can't get access. And poor vision due to refractive error, which is short-sightedness and far-sightedness, impacts on education, which is obvious, employment, and there are a lot of studies coming out regarding that, but also on productivity, more importantly. There are a lot of people with poor vision who are working. I mean, I once did a research study where there was a guy in the clothing industry in quality control who was colorblind. So you can imagine what you were buying from this company. So you know, there's a whole range of people, and then the quality of life and social well-being, whether it's going to church, reading your Bible, etc. So that's what we are addressing. Our solution is looking at. So my life has transformed into different, from Brian Alden from academia, Brian Alden, SLO, and now One Side SLO Luxottica Foundation, and each one is a different sector. And in that process, we have looked at from a system change approach, because healthcare is very different. You can't overnight generate the human resources you need. There are laws, there's regulations, there's politics, most importantly, pushback from professionals that you have to do, colleagues of mine who don't want others to be doing their work, etc. Task shifting is not the most popular thing. So we've built systems within the system to strengthen the capacity in terms of human resources. We set up clinics, provide eye exams and glasses. We worked mainly within government in my early career and trying to build those systems. Subsequently, in a social enterprise model, so in collaboration with government, where we realized that you could generate income through spectacles and use that income to achieve scale. And the last bit was now what we're doing is working back with government as well, where we're using technology like telerefraction to address the lack of human resources and bringing services within government. So that's the kind of interventions. In terms of impact with various, but I'll give the latest organizations work, and obviously this is the achievement of the organization and not me alone. It's 762 million people we've created access for. We've provided 71 million glasses and 27,000 sustainable access points created. When we say sustainable access point, it means entrepreneurs now own a small optical shop in a rural area where they are able to provide eye care and sustain themselves and their families. And we work in 130 countries. So I'll stop there.
Thank you, Corbin. Right there, in terms of just what you are addressing and the challenges, I think are coming out really clear. I took note of the politics that you're talking about. You know, so one of the barriers that you have to figure out to move. But let's also get to hear from Shona on the same. Just briefly, the issue you are tackling and the solution and the extent of your impact to date. Incredible work covered in terms of impact. Shona.
Hi, thanks, and welcome to everybody. Shonaquip is a hybrid social enterprise working from Cape Town in South Africa. We've been going for about 35 years and work specifically with children with mobility disabilities who are unable to move without mobility assistance. And as with COVID, the numbers are huge. Just in Africa, over 39 million people need wheelchairs. In SADC, maybe 9 or 10 million. And in South Africa, we're working with about 1.5 million South African, which affects just in South Africa over 60 million family members, because the knock-on effect of physical disability is significant when addressing levels of poverty within our households. Often a parent has to be out of work in order to care for their child. So Shonaquip's focus is really on ensuring that every child has an appropriate device, and parents have the knowledge and healthcare workers have the knowledge to make informed choices and agency to action that information so that children that they care for are valued. Our solution has been to design and manufacture a range of assistive technology, wheelchairs, and 24-hour posture equipment that ensures not only that the user's function is improved and they're able to get off the floor, sit correctly, and get out to school, but also that equipment prevents the development of secondary health problems which are caused by incorrect wheelchair provision. And then we also make sure that those devices are correctly designed for use in rural and off-road conditions. Chairs and wheelchairs and equipment normally designed in the north are not appropriate for use in the circumstances and the roads and the lifestyles that people live in Africa. So our solution is not only a device, it has to be linked directly with assistive technology, linked to the services and the service provision and the knowledge of the service providers. So we work closely with governments, working on health systems, outreach services, ways to upskill and share skills and standards across the health systems. But more importantly, to raise awareness within for the parents and the end users so that they can create the demand and open new markets for appropriate assistive devices in the region. At the moment, we're working with approximately 20,000 direct beneficiaries a year. We're working in 7 countries and about to start expanding a partnership in Ethiopia and exporting our products into the north, into the UK market. Our knock-on, obviously, our training and capacity building extends much further than that and is driven by a network of parents who use an app to monitor the barriers their children are experiencing in terms of achieving their rights and getting access to school and services. And that data is then used to inform policy change and budget allocation. So that's just a very short summary of what we do. Thank you.
Thank you, Shona. There is an array of different players that you are engaging, and when you come back, we'd like to hear why is this important? Because you're not just doing the devices and also making sure that they have. You're also making sure that there is knowledge, within the entire spectrum of service providers. We want to hear more. Why is this important? Because it sounds like this is something that is really crucial to the nature of the work and maybe the impact that you've had so far. I want to come to you all soon. The same. Just briefly, what are you addressing? What is this remarkable solution that you have with you, and what is the extent of your impact?
Right. Thank you so much. Thanks for the invitation and thanks for the opportunity. My name is Olusegun Oniginde. I work in Nigeria and across West Africa. We're in offices in Nigeria, Ghana, Sierra Leone, Senegal. The work we're focused is on accountability and ensuring that everyday citizens understand how public finances work and they can hold government accountable on the basis of that data. Over the years, we've figured out that governance remains a challenge, and the major point is that people in political office do not feel responsible for the people that they govern over, and also because there is no participatory mechanism that can lead to accountability in focus country. So what we started was to just even break down the information. We take on information from a very difficult, complex environment and make that simple for people to understand. So we have infographics, designs, something that makes the budget more simplified and tangible for people. And that's what we've built over the years. And the next phase of that was to make sure that the budget is a living element for people, because we don't want the budget to be an abstract document with lots of figures. We wanted to make that a living document. So we also ensure that people can track public projects around them. They can track how public projects are done around them. And we've expanded to do more than that. We've looked at accountability in climate finance, accountability in primary healthcare systems. So we also look at thematic sectors, and we do build interventions in that. We did things around COVID-19 fund accountability with connected development. So, and in between that, we're also strengthening capacity of government. So the major issue is that we believe that there's an whole of society education that has to happen on the side of government, on the side of citizens, so that they can have conversation and we can be a much more accountable society. The work we've done in budget has influenced the space significantly, because now you have government also even using infographics and design to simplify information to the public. You also have media institutions also latching on the work that budget has done and transforming the landscape that they can also break down information in more simple bits for the people. Then you also have now government also now building much more robust platforms to track public projects. So in some sort of way, we have been able to get into the system that more accountability, more transparency is required. Prior to budget, we had just 3 states. I'm talking about the subnational level that had equal access, that had access to budget, people that published their budget, just 3 out of 36 states in Nigeria. Now we have 35 out of 36 states in Nigeria that have published their budget. So on our relentless work, that more data supply, more data access is critical. And we can now ensure that citizens understand that data, and on the basis of that data, be able to hold government accountable. Thank you very much.
Thank you. Listen, incredible work, and you have your work cut out. You know, when you think about data and how you want to like engage the citizens and engage government. I can imagine, you know, just the amount of work that has to go into this, you know, getting citizens also to just understand how to interpret this data and hold government accountable. When we come back, we want to hear more in terms of, yes, there is data, but also technology, and how is that helped in the work that you're doing? You know, when you talk about transparency, there's usually it's one of those, you know, topics that when you bring government and citizens, it's not an easy one to navigate. So we want to hear from your model what's the role of technology. But before I do another round, let me hear from Stephanie. So Stephanie, as Ashoka, we have, you know, produced many reports as Ashoka Africa also. Many of them have been focusing on different themes, you know, thematic focus. Why was it important for us to work on the Roots of Change project?
Thank you, Vincent, and good afternoon, everyone. So I'm Stephanie. I'm leading partnership with Ashoka in Africa. I'm calling from sunny Johannesburg this afternoon. So hello, everyone. And it's really nice to see friends and partners in crimes, you know, in this session, very aligned about system change. And so I was part of the Ashoka team actually working on this report. I'm not sure it's very visible on the video, but this is the Roots of Change report that Vincent was mentioning, and in which Shona, Oluseun, Kovin, but also other social entrepreneurs in Africa were featured. So I just wanted to highlight actually a few points. I mean, the first point is that talking about system change is really not an intellectual exercise, because sometimes we heard or we think about system change as a very complex notion. So it's really a conversation that's centered on impact. And we all know that the problems that we are trying to address as social entrepreneurs are deeply entrenched. They are huge. You know, our potential market, quote unquote, in terms of the number of people we should reach is just huge. So it's impossible for anyone to actually address the whole issue. So it's really sort of, you know, centered on how can we have impact beyond of our organization? You know, how can we scale impact rather than just scaling our organization? So that's the first point. The second point is that system change has always been at the core of Ashoka. So Ashoka, Global Network of Social Entrepreneurs and Change Makers, was actually born in 1981. Our founder, Bill Drayton, actually coined the term social entrepreneurs. You know, they put those two terms that we typically think of as opposite, you know, together, knowing that social entrepreneurs had always existed in the history, like Maria Montessori or the Emperor Ashoka. And so since day one, Ashoka has been looking for system change social entrepreneurs. So that was really part of the definition of social entrepreneurship for Ashoka. So now we have elected, supported over 3,800 social entrepreneurs in the world, and they all need to have a system change strategy. And obviously this strategy will evolve, you know, it will iterate and it will be refined, but we want those social entrepreneurs who are thinking beyond their organization and are already thinking, okay, I could influence my system, the system I'm working in, through those different levers. And also in the way we're trying obviously to walk the talk. Youth and youth change making is at the heart of what we do. So Ashoka's vision is now everyone a change maker. So in the early years, we were actually implementing sort of workshop for young people, like, young change maker workshop. And now the way we have rethought our strategy to have a system change strategy and to see who can we partner with, who are the most influential players who actually can help us or work with us to actually transform growing up here. So just as a small illustration. And then the third reason why we actually worked on Roots of Change, and you were alluding to it, Vincent, is that Ashoka and partners have produced a lot of materials and resources about system change in the world, but we saw that there was a gap. Actually, there was not a lot of case studies, not a lot of content that was specifically focused on the African continent. And we were hearing some questions saying, are they system changers in Africa, or is it different in Africa? Or, this is a super complex, notion. So we wanted actually to just focus on what's happening on the continent. You can see here, we have a range of social entrepreneurs who are working on very different systems, very different sectors, very different countries, and they all have very strong system change strategies. The good news is that in Africa, we have over 500 Ashoka fellows, that have been elected over the years, and they all have a core system change strategies, and there are many more. I know the Catalyst 2030, network also hosts a lot of those system change social entrepreneurs. And then lastly, so we have actually developed, key messages or key takeaways for system change, for social change practitioners, for decision makers in the corporate space, in the government space, and also for funders. But I will keep it maybe for the end, Vincent, and pause here.
Thank you, Stephanie. Yeah, the why, because we always want to get to know why is this really important, and also from what you've said, at some extent, you always hear people say, okay, why? For Africa, is systems change what we need to be focusing on when we have many more people probably would benefit immediately through, direct service and all this. So I think just listening to what Corbin is doing, what Shona is doing, what Olusun is doing, and all the other fellows who are featured, and the 500 and growing, social entrepreneurs in our network, does validate the reason why we need to invest on systems change. And so, Corbin, it's all about the power of ideas and spreading those ideas through complex and from your work, these different players. It's great to hear how these different players are dancing with you. So you have the academia, you have the social enterprise, and you have large companies. They are helping advance this vision. Could you just elaborate on the precise opportunities and challenges working with these different players?
So let me take the academia first. I think in the early years, when we were arguing for a systems change approach to the social or health issue that we were addressing, academia played a very important role because it was very positive, because we were generating the evidence. But as we got more deeper into systems change and engaging government, your old research approach had to shift away from just getting data about the problem or quick measurements, trying to find out the more complex situations of how communities are reacting to the problem, their own perceptions, more qualitative research coming into the play, etc. And I can tell you then it becomes frustrating, because in academia, people want quick returns, they want publications, etc. And how we worked around that is to build capacity, research capacity within the social enterprise, and then lead the research, but include people from academia, and that was very useful. So also, I think that people sometimes are very fixed in their views, and you are coming now. Entrepreneurship is frightening to some people in academia. It's like you're trying to sell something and it's a problem. I know when as a professor at the university, I had to engage in a lot of debates around these issues, and people were thinking that I was doing it now to make some money for myself, and all those suspicions come in. So it's a very tough one, but I think academia, increasingly health systems research is gaining traction, which is good. And what I learned is that I needed to collaborate with colleagues in the public health school, in social sciences, not in optometry, which is my profession. There was limited view on some of these issues. In the social enterprise, I think some of the positive things about that has been the fact that there was a willingness to look at working both with government and bringing civil society together. And I think that was a very powerful, and that's what we have done, whether it was in Brian Alden and now in one side is Essilor Luxottica Foundation. We're working closely with them. And I think unless you accept that and embrace that fully, you're not going to achieve scale in healthcare. It's the bottom line. We've seen tons of solutions that have been tried outside government. Yes, they're successful, but whether they get to the poorest of the poor on our continent, for me, is the fundamental question. And if we don't do that, then I think the whole systems change strategy is not the most appropriate one, is not being implemented properly. Of course, there are frustrations with that, and there's disadvantages in terms of dealing with government, and also the professional pushback that we get in healthcare, or the legislation that exists, and the slow pace at which that changes, has brought a lot of difficulties. But I can tell you that those programs that I've been involved in that have been quick outside government, a lot of them don't exist right now. The ones that have been quick, but has collaborated within the system, that has worked, has ensured that occurs in a much more integrated way, they're surviving. So even when we talk about the 27,000 social entrepreneurs, they may be in rural environments. Some of them are in clinics, but most of them are independent. But there is a referral pathway, there's a collaboration with the health system. And in designing that whole system, we had to consider that. We may not have done that in the beginning, but with time we have done that and been, and that has worked. Just to give you an example, in Kenya, when we're using the telerefraction system, even though Kenya Society for the Blind, one side Essilor Luxottica Foundation, CBM are involved, but the optometrist is a public sector optometrist sitting in a regional hospital, and we brought in the technology and the systems, awareness strategy, etc., and I won't repeat others, and being able to implement that at a rural outreach level, but within a public sector collaboration, and still be able to retain what we were doing. So we started very much being less integrated, but technology has opened that. So that's the social entrepreneur. And I think the last thing you wanted me to address was the private sector. The private sector, wants to move fast. So that's a positive thing. When you have a private sector driving it, you're not fundraising. And most of you on this call know we spend so much of our life begging for money, and it's so frustrating. You have freedom to implement things better. But this push for delivery from some of the private sector organizations, we want outputs. When you're involved in system change, it's not only about outputs, it's about how you're building capacity. And that becomes a fundamental problem. And let me give you an example in our space. We identified there was no optometry schools. There were only 4 countries on the continent that had schools of optometry. And it cost $5 million to set up a school of optometry. So it's very hard when we went to some of the big companies to get that support, right? Because they want to fund something that shows that people are getting eye care, not something where you're training people and you'll see the benefit in 10 years. But system change is a long road. It's a very long journey. It's not something that can happen overnight. And you've got to look at all the barriers and look at how you can overcome that. So that's the advantage. But I also think that the sector looks at private sector partners very suspiciously. And I'm all for oversight. I would totally, say that. And in one side, EssilorLuxottica Foundation, we supported by a private sector organization, EssilorLuxottica. The advantage is they don't sell in the low end of the market, which makes it very neat. And I think those are the kind of things we should be looking at when there's a big overlap between the interests of the private sector organization and the social entrepreneurship or the nonprofit organization. Then we need to make sure that the checks and balances are there so that we maintain the proper ethics and we are doing the right thing, etc. So those are some of the challenges that come out of that. Thank you. I don't know if I've answered your question sufficiently. There's a lot.
Yeah, no, it did. Really. So that's the one thing. One of the many, incredible things about social entrepreneurs that we see our fellows, just that humility to know this is the match you can and this is the match you cannot. Just leave alone as a strategy, but also appreciating that. I like what you said, and took note in terms of in collaboration of this nature, being open to be kind of flexible when sharing about work with academia. How do you protect, for lack of a better word, weakness or a limitation, and play around your strength, and even change positions with the partner. Very strong insight there on how to approach collaboration for systems change. So, Shona, we were looking at your work also, and we talked about building networks, and you have parents, you have all these different people. How is it important to empower? Because you talked about, yes, the device, assistive device, but also knowledge is also very key. How is it important to empower your target group? And especially if you're thinking, to bring them to that point where they have the agency. Could you kindly just speak to that?
Yes, and I mentioned how we established a range of products where there was nothing. So in South Africa in the 90s, there were no children's wheelchairs. So what we had to do was create the tools. But as soon as you have the tools, you need to create the system in which those tools can be accessed and correctly delivered. So working very closely, again, as Coven says, with government, we worked on establishing guidelines and systems which then further, over the following few years, entered into the World Health Guidelines and started leading governments in a plan on how to ensure that not only the tools, the assistive technology is available, but the services and the systems and the training and the research that goes behind that. And ultimately, we get to a place where policy's in place and you've influenced the policy to address the real needs on the ground, but then you need to make sure that budget allocation is directed towards delivering on the policy into the system that you're trying to strengthen. And that is where we started working with parents to ensure not only the therapists had the training and the skills to deliver, but parents started realizing that just any old wheelchair, that people had become familiar with being donated any wheelchair and thinking that a wheelchair was just a means of getting you from A to B. And there was no realization that a wheelchair actually is a body orthotic. And with the wrong wheelchair, you can develop serious secondary health problems that can ultimately end up in your really bad health or death. So our key here was to train parents and share knowledge from parent to parent around the importance of appropriate wheelchair provision, helping them understand what they could ask for through the health system and why they could ask for it, why it was important. So really creating knowledge and agency to demand the services that government was already committed to offering, but people were not necessarily aware existed. So for us, one of the main key strengths of driving change has been to work at the top with the policy and the processes and the skills development, the transfer of knowledge and research around that, but really create awareness and agency then to action that information into reality on the ground. Just an example of that is we might have been asked by government to go and deliver a service into a community where government was aware of 4 or 5 children with disabilities. But once you get into that very remote community, engage with the parents of children with disabilities and people with disabilities around this topic, you suddenly uncover 40 or 50 children or people with disabilities hidden away in their homes, unable to access health services because of the transport issues, but also with the fear of exposure into community, given they have a disability. So raising that awareness, changing people's attitude to disability, and bridging the referral pathways from community into government services has been absolutely key to the success of shifting people's perceptions around disability, and also strengthening not just awareness and acceptance, but also improved budget allocation, because you now start really exposing the issues and the enormity of the issue that government needs to address. The other point I want to work on is that obviously once children are in a wheelchair, off the floor, out of their house and into the community, there's a need for children to enter the school system. So we focus really on an ecosystemic approach to disability support, meaning that we provide training and capacity building also in the ECD and education system to ensure that all children are welcome in one school system. And to do that, they have now got a device to enter the system. And in that way, you start strengthening not only that base of awareness, but in itself, it drives more need and more demand. So really, if you start looking at measuring the success, it's never about numbers. It's about how do we actually change the way people consider their rights to access what they have, and then how do they access that information and that product. And the only way to do that, in our understanding and from our experience, is to triangulate business, government, and end users. And in doing that, you can really shift the gaps in the referral pathways where people are getting lost.
Thank you. Thank you, Shona. And you know, as just thinking as you triangulate that, I think what really also sets social entrepreneurs apart from other entrepreneurs or innovators is basically the detailed thinking, the detailed rigor that social entrepreneurs bring into thinking, into figuring out how the engagement with these different players will look like. Just having those small details, knowing how those small details will create a ripple effect, and how, cumulatively, those are the details that then causes the shifts that are necessary for systems change.
I think it's that ability to stand back from the emotional problem and see all the role players and understand what role each of those players has in the process of joining the dots to get the flow working from between all those different elements. And when you get that right, it's just like opening a floodgate. And you start not only building a market, building economic value within the country, but you also liberate government to actually do their job well, because they don't always see the dots themselves.
True. Yeah. Make it really sound, it's a complex undertaking, but also simple in terms of how you can execute it when you have all this figured out. I want to swing back to Oluson. I had alluded to this earlier. The technology bit. Why? How is this been important? Can you just talk about the place of technology in advancing, your goals? Then Stephanie, you'll just jump in terms of, what are the key calls to action on the findings from the roots of change? Then we'll open it up for a couple of questions from the rest of participants. Oluson.
Thanks so much. Technology is a very key element in getting this work done. And for years, we've prided ourselves as a technology company, a civic technology company. Understanding that for us to be able to reach more people, for us to be able to break things down or be able to inspire action, we have to put technology and embed technology in it. And technology for us is a spectrum. It's not just another app. It means it could be just another radio programming. It could just be another app. It could just even be another tweet. Whatever makes it easier for people to engage and to demand accountability and to easily mobilize for responsible use of public resource, that means technology to us. So we situate in that way. We understand that technology is helpful for us. And the reason why we're big on technology also is the fact that it's our easiest means of reaching a mass number of people. On social media, we have a combined followership of around 400,000 people in Twitter alone, and Budget and Track, our other tool. And so there's no major way to put more pressure on government or to engage government directly that we have found than using like social media, like technology like that. So digital media and technology carries a whole lot of weight for us to be able to break things down and provide access to people. And also in that regard, we also believe that we should not just do this alone. So we're also helping other organizations build technology to accelerate their work. So even when we know that issues of abuse of public resources has to do with social justice. So those who also need legal justice or support, be able to support like Citizens Gavel to make that happen in some sort of way. Those who needed to be able to track public spending end to end, we built a tool called GovSpend. That is a community tool that tracks government spending. We started as a government budget tracking platform, but now we feel like a budget is still a projection. The actual spending itself, we want to go there. So the government started providing that data, and then we built a tool called GovSpend.ng, and that allows people to see the public budget, public spending, and be able to search that. It's a real database of over, hundreds of thousands of data. And now we're beginning to now think, how do we improve the engagement? And that's when we begin to use AI and machine learning and artificial intelligence and improving the prompts to make sure that more people can, in the snap of the finger, can have equal access and easy access to this level of data and technology. So technology is like a big deal for us. It's a big idea for us. We want to get it done, and we want to move as fast as we can.
Thank you. Yeah, technology, there's just likelihood, there'll be another offshoot very soon, Oluson. There's a lot that then you're getting a perspective of what else needs to happen, and of course leveraging technology. Stephanie, what are the key calls to action based on the findings of our Roots of Change report?
Vincent, first of all, I love this conversation. I wish we had more time, but the good news is that the Roots of Change report actually tried to detail, to have a lot of details about the model of the social entrepreneurs, the strategy. So I encourage you to read it. So I will try to summarize, some of the key takeaways, key points first of all, for social change practitioner, because often there's a lot of question that comes to mind thinking, okay, I'd love to adopt a system change strategy, but when is the good timing? If I started with direct impact, when is my model ready to actually open up? How should I do this? And it requires actually to sometimes really rethink the strategy, rethink the impact model, rethink the funding model, maybe rethinking the governance and the legal structure. I love how Shona has really deeply thought about the structural side of things, how to adapt, and how she has different entities that aligns actually for the bigger system change goals. So more in the report. And sometimes, you know, there's not the same order for everyone. Like many social entrepreneurs start with a direct impact model, they have the proof of concept, and then they decide to open up and really to go for broad system change approach. But for example, one of the cases in the report, Rita, from the stroke action in Nigeria, is a great model because she was a nurse in the UK. She saw this, like, you know, really acute need to address stroke in Nigeria. And she decided to, and she started like first with the system change model, and then she developed the direct service and the direct impact model. So she kind of did it like the other way around. Really interesting case as well. And, you know, sometimes for the social entrepreneurs, there's also this question of how do I fund it? Because what we hear and over is that the most important part of the work of the social entrepreneurs, the system change work, is actually the least funded. So how do I do it? And I mean, the good news is that it doesn't need to be expensive. In the case of Rita, so you can think creatively. There may be other funding model, membership fees, you know, valuing and valorizing data, maybe, you know, some income generation model about data, about, you know, doing consultancy. In the case of Rita, she started with serving as a nurse in the UK to actually start it. I think her starting budget was $10,000. So it's also inspiring to see that, you know, some of those most impactful models do not need always to be expensive. And again, it depends on the system, the sector, and so on. There's also a bit of confusion sometimes, you know. Actually, you know, the mainstream definition of social entrepreneurship has really moved towards social enterprise. And sometimes the focus is actually more on the legal structure rather than the impact model. So I think we really need to really center the definition of social entrepreneurship around the impact again. And just very quickly, for the funders, again, as I was, you know, saying, we hear over and over from our social entrepreneurs that system change work is actually very hard to fund. And there's a paradox because, you know, system change has become so much of a buzzword. You look at website of foundations and so on, everyone is speaking about system change, but the funding practices actually take time to evolve. And obviously it's more complex because it's, as we said, it's long-term. So if you have short-term goal as a foundation, then how do you do it? And then it's less easy to measure. It's actually more complex to measure. But then can you have milestones? You know, can you actually define your system change goal and have milestones along the way so that you can reporting, I'm successful here and here. And we know it's complex. Actually, Catalyst 2030 has been also very creative. There's some award for, you know, the system changing founders. You know, I really love this model. And we've worked also, especially our teams in the US, like Ashoka US and Catalyst 2030, have worked and have entertained conversation also with donors and have salons, you know, donor salons around system change. And I think this is one of the next session actually of this convening. So I encourage you to join. So I will pause there and really sort of encourage everyone's social change practitioners, you know, founders. We didn't talk too much about corporate decision makers, government decision makers, but obviously they're also key in this equation, and we need their influence, you know, we need their expertise to actually shift system, because that's really, we say it takes a village to raise a child. Well, it probably takes more than a village to change a system.
Thank you, Stephanie. Yeah, and like you said, I mean, this conversation is interesting, and I wish we had more time to continue, but I can see we only have 5 minutes left, and I would want to hand it over back to the Catalyst 2030 team, who've done really amazing work to put this together. But before that, I know there are comments, there are questions. We might not get into them right now just because of time, but my hope is that out of the 4 case studies that we have shared today, and the many that are in the root of change, and also the many more who are part of the Ashoka network, and maybe also some part of the Catalyst 2030 network, we can find inspiration and insight in how to think around systems change, to make our goal-based systems change, because that is absolutely important, because it is important. But also, as we think about the systems that we want to change, you know, the solutions that we're working on as social entrepreneurs, all the solutions that we want to fund as funders, or where to collaborate, you know, for government that is looking at efficiency and effectiveness in service delivery. The other thing that we should be thinking about, and also encourage others to do, is to find ways of outmatching these challenges on the continent with solutions. And the only way to do that is to get everyone to be a problem solver, or as we say at Ashoka, everyone a change maker world. And that is primarily our focus as Ashoka at the moment. I want to get it back to Brian. Thank you so much for allowing me this opportunity to moderate this conversation. Thank you so much to the rest of the panelists. Colvin, Shona, Olesun, congratulations for the amazing work that you're doing. And Stephanie, also having been at the forefront leading the putting together of the report, and our funders for the report. Back to you, Brian.
Thank you so much, Vincent. Mine is just thank you all. This has been an amazing session. Again, lots of change for social entrepreneurship, advancing systems change in Africa. I want to thank everyone who's participated in this. We want to invite you to attend the last day's sessions. We only have about 2 left. Make sure you engage with them. Make sure you learn as much as you can. It's about unlearning and learning as much as you can. Thank you so much, everyone, and have a beautiful, beautiful weekend. And hope that we can get to connect and work with you in the long term. Thank you.
Thank you very much. Bye-bye.
Thank you.
Thank you,
Bye,
everyone. Bye.
Thank you so much. Bye.